In 1994, we see the establishment of the Oregon Health Plan. 1997, physician-assisted suicide is legalized in Oregon. In 2008, we see the case of Barbara Wagner, where the Oregon Health Plan denied her access to chemotherapy, instead offering physician-assisted suicide. January 31st, 2009, the National Institute of Health Director of Bioethics, Ezekiel Emanuel, wrote a paper for The Lancet, a very prestigious medical journal. In it, he introduces something called the complete lives system. Well, specifically, he's talking about what to do with medical procedures in an age of scarce resources. If we look at the graph of the complete lives system, we see the probability of receiving a medical procedure on the left and the age and years on the bottom. The complete lives system produces a priority curve on which individuals between the ages roughly 15 and 55 get the most substantial chance of a medical procedure in an age of scarce resources. Now listen carefully, and we're looking for patterns in thought. Ezekiel Emanuel says, consideration of the importance of the complete lives system also supports modifying the youngest first principle by prioritizing adolescents and young adults over infants. Adolescents have received substantial education and parental care, investments that will be wasted without a complete life. Infants, by contrast, have not yet received these investments. If we look at the graph at the far left is age 0 or birth. That makes me think of Peter Singer saying infants born with a disability wouldn't necessarily receive medical care. Ezekiel Emanuel says we put a lot of time, money, education into getting children into their late adolescence and early 20s. And it also happens to be when they're producing for society. You're young, you're strong, you're productive. You're not consuming much for medical resources, but you're contributing to society. Those are the folks that are getting treatment, up until about the age 55. After that, the probability of receiving a procedure drops way off, but this is when seniors need health care. Ezekiel Emanuel says, unlike allocation by sex or race, allocation by age is not discrimination. Treating 65-year-olds differently because of stereotypes, now that would be ageist. But treating them differently because they have already had more life years is not. Well, as it turns out, Ezekiel Emanuel is the brother of Rahm Emanuel, the former White House Chief of Staff. And as it turns out, Ezekiel Emanuel was also a White House healthcare policy advisor during the development and implementation of the Patient Protection and Affordable Care Act.